Think back to the last time you were prescribed a medication by your doctor or healthcare provider. You'd hope that they're being prescribed to you for the regulated purpose, right? What if I told you this may not be the case? Many doctors prescribe off-label medications. This is a legal and very common process. According to ahrq.gov, 1 in 5 prescriptions written today are for the off-label use. There should be stricter regulations put in place in order to protect patients. There are many drawbacks to prescribing these medications, and the lack of evidence and research cannot prove that these drugs are effective and beneficial to the patient. Today, we'll be going over many topics within this problem. There are many components that we will be looking into. First, we will discuss the background on these medications, as well as transitioning into why the doctors prescribe them in the first place. Then we will finally look into the possible concerns and side effects when using these medications. First, let's further your understanding of what an off-label prescription drug is. According to WebMD, off-label means that the drug is prescribed in a manner not specified by the FDA's package or insert label. Every prescription drug in the United States has this approved label. These labels are made in order to prescribe the instructions used to determine the uses and the doses compatible for the patient. If this review shows that the benefits outweigh the negatives, this prescribed drug may be put on the market in order to be sold. This is why I think there should be more regulations instead of banning it in its entirety. Many patients may be benefited by this if they've exhausted all other options like rare diseases and other forms such as cancers. This is one of the few reasons these drugs may be beneficial. Despite the prominence of the use of these drugs, WebMD says that the patients that are receiving these drugs are not knowledgeable that they are receiving them in the first place. Many patients are unaware that they are using them, and this is a lack of transparency between the doctor and the patient. According to WebMD, doctors are not required to tell the patient that they're being prescribed these drugs, but they are required to share the risks of every medication that they are giving these patients. Medical News Today says that off-label drugs can put people at risk for receiving ineffective or non-beneficial treatment, and this may be one of the most risks. As stated before, 1 in 5 patients that are prescribed these drugs1 in 5 people are This shows that doctors are not using them as their final resort. There are many risks and side effects that present using these drugs. Some may include nausea, heart palpitations, slow breathing, but could go as far as death, cancers, allergic reactions, heart failure, and liver failure. Today, we briefed on many different components within this problem. We talked about the background of these drugs. We transitioned to understanding why these doctors prescribe these drugs in the first place. And finally, we discussed the concerns and side effects when using these medications. There should be more restrictions put in place in order to protect these patients, and the lack of evidence shows that these drugs should not be prescribed for everyday use. Only for the harmful and rare diseases such as cancer should be prescribed these medications. Thank you.